Parkview Health is a nonprofit community-based health system serving a community in Northeast Indiana and Northwest Ohio. We consist of 12 hospital facilities, 4 retail pharmacies, a specialty pharmacy, and a large network of primary care and specialty care physicians.
Parkview's mission is to ensure that our community has a place to come that's safe, that we know that they can get excellent care both in times of joy for birth and times where they need that outreach of help.
Our mission is to inspire well-being and improve the health of the communities that we serve.
Every single day when someone comes into a hospital, there is a drug that may save their life, a piece of med-surg equipment that allows them to have their procedure completed. So if we look throughout the industry, all supply chains have recognized the importance of having the inventory on hand that they need to be successful. When you have hundreds of thousands of line items, you need technology to be able to take that information in, aggregate that in a way that allows you to do predictive modeling and understand what your needs and responsibilities are.
The inventory system that we had in place prior to our Texas project, we actually implemented in 2003. We selected a product at the time that met our needs at the time, and the system just didn't evolve with the market. We had buyers who were very good at what they did with a very rudimentary system. A lot of tribal knowledge. They had, Post-it notes stuck to their bulletin board that said, when you need X, you call this guy. And so we needed to overcome that sense that they knew what they were doing and did it well by really showing them what the future would look like, that the frustrations that they had, we could solve those frustrations and make the rest of their job easier so that they could focus on the things that they really needed to focus on.
A lot of times we see in health systems that there is a great divide between the supply chain team and the pharmacy team. They are operating in complete silos. Parkview took the approach of really linking arms and understanding each other's differences and how they could benefit from the strengths and knowledge, deep knowledge of the supply chain group, as well as the nuances and uniqueness of the pharmacy group.
There's multiple classes of trade that we have to manage now. Manufacturers sell drugs to hospitals, health systems, and the healthcare market in general at prices that are based on where the drugs are administered, right? You've got different prices for hospitals than you do for retail pharmacies, than you do for ambulatory surgery centers or freestanding oncology businesses. So we have to manage all of those different classes of trade. We have cold chain issues that we have to deal with, medications that are refrigerated and frozen. We have medications that, have different light sensitivities. And then on top of those sort of conditions, we've also got a regulatory framework that's pretty extensive. We have to follow FDA regulations and United States Pharmacopoeia, Drug Enforcement Administration, state boards of pharmacy, and therefore you need to ensure that you've got a pharmacy inventory management system that can adhere to those regulations.
As pharmacy is starting to evolve and get more complex, it only makes sense to really adopt those supply chain methodologies that we've been so successful with and bring the pharmacy purchases into a more consolidated service center similar to what we've done in the med-surg and supply chain general area.
We've had our consolidated support center available for the last 13 years. In that, we've looked at warehouse management, we've looked at demand planning, we've looked at point of use technology. All 3 of those were items that we also wanted to make sure that our partners in pharmacy could do. So it was an easy sell for us at the executive level, knowing that we were going to have a lot of efficiency in managing inventory and making sure that we have the products that our patients need.
Our IT folks understand the Texas platform. And more importantly, or at least as importantly, our finance folks are comfortable with the Texas platform. So it kind of takes pharmacy from behind the curtain to in front of the curtain. It gives us some visibility and transparency in the organization that we haven't had before.
It is so important when you launch a project that you have both executive sponsorship and agreement, and you're fulfilling the organization's needs. We had to have alignment with people, processes, and technology. And if one of those elements isn't fulfilled, you have a weakness. It's called the iron triangle. So if one of the legs of that people processing technology fail, then you don't have the optimum strength that you can get. So it's really important to make sure that we have alignment of all those assets in order to provide the most benefit to our inventory system.
Parkview's model of how they have implemented their pharmacy supply chain is a model that can be adopted across the nation at healthcare systems. What services might be offered at those healthcare systems might look a little different than Parkview, but the understanding of the planning and implementation, the design and analytics, data collection, testing, training, that buy-in, the change management, that's all across the supply chain and project management spectrum. So it's not anything new, but it is more so in having that engagement from top to bottom and maintaining that engagement throughout the utilization of that model.
In the pharmacy world, we'll never be rid of our problems, but I do think that this solves most of my inventory management problems. We've got technology now that we can drive into all corners of the organization. Everyone who needs to order medications can order them from pharmacy easily. They know what I'm going to charge them for it. We've got full transparency at the transaction level. Because it solves those problems for us, it enables us to take those resources that were spent solving problems within the pharmacy going forward and devote those resources back into improving the health of our patients and making sure that our providers and our nurses have what they need when they need it.